Yeah, thank you so very much. Greetings wherever you are getting us live. This is your education Bantaba platform that always takes place every Monday from this hour onwards. I am your presenter, Mr. Sanyang, and then my co-host is Babu Kariye Buso, who missed this place. But anyway, due to his personal engagements, that is the reason why we have not been receiving him here. But anyway, still acknowledge the Ministry of Basic and Secondary Education, more especially the Regional Directorate of Region 2 West, Mr. Paul Bendy, and then the entire officers of Region 2. Still, also, it's very important to acknowledge those people at the recipient end, more especially the students within Region 2 West and then the Gambia at large. I will start with Mahad this time, and then Brikama Potfok, Brikama Methodist, Anna Marie Mansakoli, Brikama Lower Basic School, the Mother School of all schools within Region 2 West, St. Peter's down to Newsrat in Region 1, and then down to Basse, LRR, and then you have NBR. Thank you so very much for following this unique platform. Without you people following, I wonder how the education Bantaba will look like. But anyway, thank you instantaneously for always keeping an eye to the education Bantaba platform. As I stated earlier, I am Mr. Sanyang, a teacher, a journalist, and then an activist, and also a TV presenter. Without wasting more time, I also receive two gentlemen and then one female representing the public health at the University of the Gambia School of Health, and then we'll be discussing a lot about the school, and then the topic also will release after giving them the baton to introduce themselves. So I'll start from the gentleman. Please tell us who you are and then your position, please.
All right. Thank you very much, Mr. Sanyang. We are very much, glad and opportunity to be here in this, important discussion, the education Bantaba. My name is Dauda S. Diallo, and I am here in my capacity as the president of the Students Association of Public and Environmental Health, University of the Gambia. Yeah, we are definitely very glad to be here to join this discussion today. Thank you.
Oh, okay. Thank you, Daura S. Jallo. As you rightly mentioned, he is the current president of the Student Association of Public Health at the University of the Gambia. Thank you so very much for honoring our invitation, madam.
Okay, thank you so much, Mr. Sanyang, for having us here. I am Usay Balde, the Finance Minister of Student Association of Public and Environmental Health, and we are so glad to be here today to discuss about a very important topic, which is a major public health problem in the Gambia. Thank you for having us.
Honestly, you see, I think I'll not go home without taking your contact as a financial minister. Anyway, yes, Mr. Jamme, yes.
Yes, good morning. I am Modulamin Jamme from the School of Public Health, formerly at Gambia College. Now we are transiting into the UTG. I'm a student representative for Students Health Promoters Association.
Okay, thank you for honoring our invitation. And then I think the discussion will be fruitful. As we all know, health is number one.
Yeah, sure.
Health is number one. They say a healthy mind. Okay, anyway, and then as they rightly mentioned, today our topic of discussion, we purely focus on health, because we know without health, there will be no proper learning in our school as a teacher. So I know health is very important, health is very key, and then health is number one in the development of any nation. So I trust with these young and vibrant youths, I will give you all the synopsis we think is very important to our personal health, and then the sensitization begins since last week. If my memory can serve me well.
Yeah.
And then still the sensitization is going on health and other related matters with health issues. So, Mr. Please tell us first your role at the university as the president of the Student Association of Public Health. What is your role?
Thank you very much, Mr. Sanyang, for the question. I think that one is a thought-provoking question, but I will try my best to narrow it down. Like I mentioned initially, I'm the president of the 13th Executive Council of SAPE, that is the Students Association of Public and Environmental. Basically, my role is just to be there for the students. That is what we do at the University of the Gambia, to represent the interests of the students that we are serving. So, but as the president, that is one of my mandates or my objectives, to represent the interests of the students that we are serving, or the students that voted us into office. So, one of which is to help expose our students out there, because if you affiliated with the university structure, is that we only learn theories most often. So it is the responsibility of the association, of which I am spearheading, to help translate some of the theories that we learn in class into real life. So basically, that is what we are doing at the moment.
Yeah, Finance Minister, tell us your functions, your role at the university.
Thank you so much for that question. Yes, my role at the university or at the Students Association of Public and Environmental Health as the finance minister, I am responsible for handling the finance of the association to make sure that the finance is kept safe and it is kept transparent and every butut is accounted for. So that being the case, I hope so their finance is safe with me. And today we are here just to, like the president mentioned, to make sure that the association, yes, we are here to make sure that the association is in a good condition and also to promote the health of the people. So this week we are here to promote the health of the public by sensitizing, bringing a topic that is very important in the Gambia. Thank you.
Yes, Mr. Jammeh, can you take us through?
Yeah, sure. As I am representing the Students Health Promoters Association, our key role is to ensure that we promote health within the country and even beyond. And that is why we are here today, to ensure that we inform the public on some of the important things they need to understand about HIV and AIDS and other health related topics that are holding profound importance to us as citizens of this particular country. Thank you.
Yeah, viewers, those are the receiving end. Our topic of discussion will focus more on educate, protect, nourish HIV and AIDS, awareness, and material nutrition. That's going to be our topic of discussion. And then I trust these vibrant youths, they'll make justice to this important topic, as far as I alluded earlier, that health is everything. Health is everything. There will be no health, there will be no education, proper learning without health. So I think health is number one. In every nation, they should prioritize health first before anything. So please tell us about your desensitization.
Thank you very much once again, Mr. Sanyang. Like you alluded, health is is the foundation of everything. If you see that we are here right now, it's because we are healthy. So like I mentioned earlier, one of our mandates as Students Association, that is public health related, is to help fill gaps where we feel there is. And this time around, we thought it necessary to go out and help sensitize our people that are out there that are not opportune to have access to certain information. So that is where the health promotion weeks comes to play. Like you mentioned, it started some time back. We started on the 13th, which was on Monday, and the theme of the health promotion week is, like you alluded, educate, protect, nourish, HIV awareness, and maternal nutrition. Now, if you look at the theme, you will realize there are two key health issues embedded in the theme. That is HIV awareness and maternal nutrition. So the way we are doing it, for the HIV and AIDS awareness, we were specifically targeting schools. We understand that though most of the the population or the people in schools, they are not specifically in that category where they will get some of these diseases. But we want to use them as a medium of communication, because we know that most of them or all of them are from homes. So these kids, whatever you tell them when they get back home, they relate it to their people. So that was one of the reasons, or the reason why we targeted schools. And over the past couple of days, we've reached out to several schools. I think almost more than 10 schools we've reached out to them within Western One and Western Two region. And the other specific health issue that is embedded in the team is maternal nutrition. Now, this is also a very, very important key health issue, that are affecting our mothers and sisters, when it comes to maternal, nutrition, education, or awareness. So this also, what we did is that we targeted, specific communities in the form of, health facilities, because most often they normally have this how do they locally they call it nurse. Yeah, so we target specific days and go there and help educate them on maternal nutrition. So basically that is the concept of the health promotion week, and so far we've the impact that we are able to make is definitely something that is very, very impressive, and we hope to continue. Just yesterday we were at GRTs again, because we don't just want the minority to have access to the information. We want almost everyone, as far as the information can go, we want it to reach there. That was the reason why we had a session with GRTs yesterday, and it was definitely a very, very good one. And today we are at Atlantic TV to do the same. So like I mentioned, that is the team, HIV awareness and maternal nutrition. And this time around, the gap we want to fill is that you cannot prevent yourself from something if you are not aware of it.
Certainly, I will come back to you as the president of the Student Health Association at the University of the Gambia, that DS, formerly called. Madam, please take us through, how do you come up with this initiative?
Thank you so much for that question. Okay, we have seen like these two things that the president just mentioned, that is HIV and maternal nutrition is a major public health issue in the Gambia here. So we have seen like the prevalence of HIV has risen to a certain level. So we deem it necessary to come out, help educate people, raise awareness so that they can know what HIV is all about, the signs and symptoms, the preventive measures, and the effect of HIV on people. Maybe with this thing, if you are aware of what HIV is, and you know that this is a condition that can be prevented, it is a condition that can be treated, so at least you will be able to know how to go about it and how to prevent yourself. So we think it is very necessary to target schools and to target our mothers, talk to them about maternal nutrition. We know that school, the students at schools are the main agent of changes. So when you want a change, you target these people, because once they get the information clearly, they will go out there, talk to their families, and talk to everyone that is close to them. So we deem it very necessary to make sure that this health promotion week is successful and the messages that we are giving is clear and it reaches to the masses, like a high number of population.
Yes, Mr. Jammeh, take us through HIV and AIDS as a public health officer.
Yeah. So HIV and AIDS is a very, very important issue to discuss, because what is attached to it is what we call stigma and discrimination. So once people are not aware of the reality surrounding HIV and AIDS, it is of course a problem for them to even go to have their test done at facility levels. So this is why there is an increment in the number of people who usually have HIV and AIDS. Now, looking at the situation of the Gambia, we have 26,494 people that are living with HIV and AIDS, and that is a very significant number. So looking at it, we need to bring things together as public health people in order to ensure that people are aware of the reality surrounding HIV and AIDS, and not to prevent themselves from knowing their status as they live. So it is something that can be transferred from one person to another, and there are so many ways that it can be transferred from people to people. So this is why we deem it necessary that people are aware of how things are in the real world.
Yeah. can you start me? HIV and AIDS, please.
Yeah, thank you very much once again. Just like he mentioned, we might necessarily think 26,400 is a small number out of the 2 million almost people we have in the Gambia, but that is a very, very significant number. Yeah, and the worst part of it is that only 60% of that number know their status, that they have HIV. Like I, concluded my last speech, you can only prevent yourself from something if you know it. But out of the 26,000 plus individuals that are living with HIV, as per current reports by NAS, that is the National AIDS Secretariat, only 60% of that number, which will amount around 15,000, know their status. The remaining number don't know they have HIV. So you can see there is a big gap there. If you don't know you have a particular disease, obviously you will not seek treatment or protect yourself or even protect those that are with you. So that is a very, very big issue that I'm very sure the National AIDS Secretariat is working on, because HIV, the way the disease works in the body, you can have it for a long time without exhibiting any signs and symptoms. It's something that is very, very serious. You can have it, it will be damaging your system, your immune systems, while you don't exhibit any signs and symptoms, and along the process you will be transmitting the disease. That is why the prevalence is on the rise, because of those people that are not aware of their status going out transmitting the disease. So I think that will be one of the that is one of the major areas the National AIDS Secretariat is working on, that is helping people identify their status, know their status, because once you know that, obviously you will be careful with how you go with your life. Yeah.
Yeah. Sandra?
Yes.
Yeah. Do you also want to say something about AIDS?
Yes, I will.
Yeah.
First of all, want to talk about what HIV is and what AIDS is. First of all, we talk about what HIV stands for. This stands for Human Immunodeficiency Virus. So HIV is a virus that destroys the immune system, like it weakens the immune system by destroying the T cells. So when this happens, when it destroys the T cells, these are cells that fight against infection. So when these cells are destroyed or their counts are low in the blood, it makes you prone to diseases or infections. So when you say the AIDS is a condition that is developed due to the presence of this virus, that is the HIV infection. So when you have AIDS, this is you are at a stage where any infection that comes, you are prone to it. You cannot fight against this infection because the immune system that fights against the infection is already weak. So these are the difference between this is the difference between HIV and AIDS. So HIV is a condition that cannot be cured, but it can be treated. So once you know your status, when you go for screening, you know that you are having HIV infection, and you start treatment at the early stage, you will be able to prevent yourself from having AIDS. Because if you take the treatment, these drugs are going to suppress the virus level in the blood, that is the virus count. The viral count, we call it the viral count in public, and the viral count in the blood, to an extent that it will not be able to multiply and you will not be able to transmit it from one person to another. Yeah, that is.
Yeah, I think it's very important for those at the receiving end to take this discussion platform very seriously because it's about HIV, and then they all stated well as the way HIV is transferred from one person to another, and the number of people within the four corners of this country that are affected by this virus. As she rightly mentioned, HIV is a virus, and we all know, even in general science, diseases that are caused by virus and the diseases that are caused by bacteria and so on and so forth. So I think, Mr. Jamie, you can tell us, or you can still go ahead, because AIDS is always a problem, especially in our society. There are so many people within the society whom we know that they are affected, but the problem is to report themselves is always a problem. So can you please take us through that?
Yeah, so I think one of the most important things about HIV and AIDS realities is the fact that there should not be stigmatization and discrimination within the society. And I think this is one reason why people find it very difficult to at least go for their checkups and then know their status for HIV and AIDS. Because if one is said to have HIV and AIDS, then that means many people within the society are going to distance themselves from you because of the misconceptions they have about HIV and AIDS. Some may not even want to share food with you because they think that sharing food with you can transfer the virus to you. Some may not want to be close to you because they think that being close to you merely can lead to the transfer of the virus. So this is actually something very, very important, which is why we want to ensure that we inform the public on how HIV can be transferred from one person to another and how one can prevent him or herself from having the virus. This is a very, very key part of this particular discussion. So I believe my boss will try to discuss some of the ways it is transferred.
Don't you think that the society also is influencing HIV?
Absolutely, they are influencing, and that is one of the biggest gaps or challenges the National AIDS Secretary are facing. That is stigmatization. That is why people are not going to the health facility to get tested and know their status. Like I mentioned earlier, out of the 26,000 people plus, is only 60% that is aware of their status. Perhaps the remaining individuals, they don't want to be stigmatized, or they don't want people to look at them otherwise when they explain their condition to other people. And yeah, because once you tell someone that I have HIV, the way that individual will look at you after that discussion will automatically change, because they always have these misconception that HIV can only be transmitted through sexual intercourse. It means that you were having sex, that is why you have HIV.
And you are given a negative portrayal.
Negative portrayal, exactly. But there are other means that individuals can have HIV apart from having sexual intercourse. So stigmatization is one of the biggest problems the people that are fighting for HIV are currently facing. Is because because of that, people are not going to get tested and stuff like that. So the other ways that individuals can transmit the virus is through cuts. When you have a sharp object as an individual that is HIV positive, you cut yourself and you have remnants of blood in the tool that you use to cut yourself. Then another individual comes and use that same tool and also prick or cut himself. The virus can be transferred as well. And also even mother to child, it is very, very possible. But if the mother is HIV positive, there is high probability that this child can also be affected as well. So the transmission mode is not just about sexual intercourse, though it is the most prominent one, is the most talked about. That is why when you say I have HIV, people affiliate it with bad things, that you are having sex with different people. That might not be the case, but it might be other ways that you will get any of this thing. Even those at the barber shop, sometimes when someone that is HIV positive goes there to get a nice cut, and the barber mistakenly cut the skin and uses the same barbing machine for without sterilizing it. So which is also very important. So you can see there are a lot of ways, blood transfusion as well. Yeah, but then I'm not sure that will be a big issue, since we have professional nurses or doctors doing that. That is why before your blood is transferred to another individual, they screen it thoroughly to see that you don't have any infections that can be transmitted from you to another individual. So these are some of the ways HIV can be transmitted, not just sexual intercourse. I think that is a big misconception that people have, and that is why they always attach stigmatize other individuals that have the virus.
Yes, Madam Finance Minister, can you give us the main thing, which how HIV can be transferred from one person to another? Yes, I don't say the minor, but the main.
Okay. Like he rightly mentioned, there is no one way that HIV can transmit. It can transmit it from one person to another in different ways, mostly through the body fluids. That is the semen, the vaginal, the semen, the vaginal fluid, and also the rectal fluid, and it can also be transmitted through the blood. So when we say, as we said this, then one major way that HIV can be transmitted from one person to another is unprotected sex. Like you have sexual intercourse without using a condom. You have a sexual intercourse with a person who is infected with the virus with condom. You don't you can transfer the disease from you to that person. And the second way, like he rightly mentioned, is blood transfusion. Though it's not very common in the Gambia, because mostly before you transfer blood or you donate blood to a person, you are tested first to ensure that you are not having the virus, so that the virus cannot be transmitted to that person. And the third way, like he mentioned, is through mother-to-child transmission. When the mother is HIV positive, she can transfer the virus to the child. And this can happen occur in 3 ways. That is during pregnancy, when the virus transfer through the across the placenta. And the second way is during labor, that when the mother is giving birth, when the baby comes in contact with the blood, the virus can also be transmitted. And the third way is during breastfeeding. When this virus is present in the breast milk and this milk is breastfed to the child, the person can also have the virus. And also drug addicts. You know, some people are there, these drug addicts, they use syringes to inject themselves with the drug. So when an infected person inject himself or herself with the drug, and another person uses that same syringe without sterilization, the virus can also be transmitted. So that being said, we can talk about preventive measures. So
Yes, Mr. Jamme, can you give us some of the signs before we move into maternal nutrition? Yes.
Yeah. So usually when one has HIV, usually you may first have flu-like symptoms, like when somebody has cold. But at some point, you will not be showing any symptoms, significant symptoms on your body. So it might not be noticeable when you are just having HIV. But once it has improved into AIDS, that is where you tend to see most of the symptoms. And of course, your body will become very, very weak to an extent that you always welcome diseases. And that is why HIV and AIDS is a very, very serious health condition. Yeah, so another thing I wanted to connect to what she said is about the mother-to-child transfusion. And it can be prevented. It's not like when you are having HIV and AIDS as a mother, you're going to have a child. You can still have a child, but you need to go to the hospital as early as possible for you to be able to be given the prophylaxis in order to ensure that there is no transmission of the disease from the mother to the child. So mothers with HIV can still have children who are safe from HIV and AIDS. Yeah.
Yeah, can you give us some of the signs?
Yeah, right. That is, like I mentioned earlier, HIV is, is a very invasive disease, virus, sorry. When you have it, before you exhibit signs, it will take, quite some time. So, but one of the signs that, people with HIV can have, which is very common, is fever. That is almost common to almost every disease. When you have it, you have fever. The other one is, fatigue. You always, be tired. Very, very tired. Like, my finance minister mentioned some time back, when you have, the disease, it destroys your immune cells. And when that happens, it means you are prone to almost every disease. We know that flu, is, a common virus that people, have, and, it takes days before it subsides. But as a HIV individual, when you have flu, it will become so serious that you might even visit the afterlife, because, the white blood cells that are supposed to protect you are not there, or they are very weak. So is fatigue. Fatigue, someone with HIV will always show that sign. The other thing is, sore throat. Your throat will be very, very sore. Like even drinking water or eating will be very, very difficult. Yeah. So my bosses will help me with the other side.
Yeah, and we are running out of time. We all know that TV is based on time. But we quickly move into maternal nutrition. Please take us through that.
Okay.
Okay. Yeah. Anyway, we come. Yeah.
We can continue.
Yeah, we can continue.
Okay. Thank you so much. As public health officers, knowing the disease, the signs and symptoms is very important. But we also want to talk about the preventive measures, because for us, we don't want anyone to feel sick. We don't want people to fall sick. All we want is for them to be prevented. So that is why any topic that we come with, we first talk about, before concluding the topic, we talk about the preventive measures, that you can take to protect yourself and your family, the family and the society at large. So the preventive measures for HIV and AIDS, as we said earlier, it can be transmitted through unprotected sex. So always, first thing you do is abstinence. When you cannot abstain from sex, you will make sure that you use condoms during sex. That is very important. And we also talk about the vertical transmission from mother to the child. And this one also can be transmitted, like my boss mentioned here, where mothers are always advised, we encourage them to go to the clinics as early as possible. That is their first trimester. That is the first 3 months of their pregnancy. You go to the facility, you go through checkups, you are screened for HIV, and if you are positive, you are given prophylaxis. This prophylaxis is going to make sure that the viral count in the blood is reduced and extended. It cannot be transmitted from the mother to the child. Yeah, so another preventive measure is also to sterilize materials before using them. When one person uses a syringe or any other thing before another person uses it, you make sure that it is sterilized first. Yes.
Yes, can you take us some of the preventive measures?
Yeah, like she rightly said, prevention is better than cure. So of course, he also mentioned something like the drug addicts, as they are using these sharp materials in order to transfer the drugs into their body. It is also very important to ensure that you don't share the sharp material, because you don't know whether the virus is within that particular person or not. That is why it's always very important to ensure that you avoid using sharp materials that you don't know who actually used them. Because usually at homes, we see people, you found a razor, lying down, you just carry it and start trying to cut your nails. And that is very, very serious, because you don't know the status of that particular person who used that particular razor. Whether it is a family member or not, you must always be careful to avoid using sharp materials with people that you don't know about.
Yeah, my boss, sometimes it's very difficult for the people who are positive with HIV to break the silence. So what words or what advice do you have for those people?
Thank you very much once again. HIV, we know it's a deadly disease, but the world has advanced to that level that the disease can actually be managed. We have, countless
Managed
people.
for how many years or how many months?
It can be managed for a lifetime as long as you are on your medication. That is why, once you have the disease, you get yourself, tested. If you are positive, they will put you on in a therapy. It's called antiretroviral, therapy, which is very, very good. Now what that therapy does to your system is very simple. It will not cure the HIV. We mentioned that earlier. HIV cannot be cured, but it can be managed. So once you have HIV and you are on medication, on the ART therapy, it will help suppress the viral load in your system. Yeah, the viral load in your system, the virus has to be, multiply in your system for it to advance to the AIDS level. When it reaches the AIDS level, there is almost nothing anyone can do with it. But before that, if you are on your ART therapy, that medication will help, reduce the viral load. You can be married, have kids, you can even be having sexual intercourse without, transferring the disease and all others. Because why? The viral load is in your system is not sufficient enough for it to be transferred from you to another individual, which is very, very important. And it was a major breakthrough, because we roughly have, more than 40 million people with HIV globally. So with the, the advancement of, science and technology, they were able to come up with this, and I can tell you it is very, very effective. So the big challenge now is identifying those that are with HIV, and the only way that can be done is for everyone to be tested. Even if you think you don't have HIV, like we mentioned, maybe you don't have unprotected sexual intercourse, but you might be in contact with other ways that you can have HIV.
Yeah.
But so getting yourself tested is the best way for you to keep yourself safe. And whenever you suspect you might be having it, rush to the nearest facility. They will help you with that, and they will put you on the ART therapy, and God willing, it will be okay.
Yeah, because some of the challenges you people, public health officers are facing. Yeah.
Okay, thank you so much for that question. Some of the challenges that we are facing as public health officers is like people normally don't go for screening. Most of the people, even the health workers, they don't want to know their status when it comes to HIV. This is because of the stigma that is attached to HIV. So it is very important, because as a person, we cannot just look at you and say you are having HIV. These symptoms can be symptoms of other diseases. So all that we will encourage or we will want people to do is to go to the facility, get screened and know your HIV status. If you are HIV positive, so that at least you can start the treatment and the disease will not be transferred from one person to another. Thank you.
Yeah, how about you?
Yeah, so I think the major issues have been discussed, but then it's still important that we always remind the people that you should not feel discriminated or isolate yourself from people because of having HIV and AIDS. It's very, very important because a person's mental health is very, very important. In as much as you are being stigmatized or discriminated within the society, of course, it is going to affect your mental health. And of course, I don't believe a person can live very long with so much stress on that particular person, because everybody that you love, everybody that you care for will tend to isolate themselves from you, and that is a very, very bad situation one can be in. So if somebody knows somebody who has HIV and AIDS, what you can do is to support the person in any way that you can, to ensure that the person can be able to live with it and then manage it. So it is very, very important that we socially help each other no matter the situation, because
Yeah,
it
certainly.
can be
And then we are in the conclusion part. And then please, what advice do you have to the general public about HIV?
Right. So, you know, we as public health officers, we don't want people to get sick in the first place. So that is, you know, why we go out and talk to people. We say prevention is better than cure. So my final advice is that, just like Mr. Jame rightly mentioned, you know, for us to show that social cohesion with people that are having challenges with the disease, because if that is there, honestly, all those that are with the virus or the disease, they will actually go and get themselves screened and also seek for, you know, medication. But if we start pointing fingers at each and everyone, definitely it will not help us as a country. And you know, the incidence of the disease will just keep on rising, because that is, like I mentioned earlier, that is the biggest challenge that we have. People that are having the virus are not coming out, you know, to get themselves treated. So the reasons why they are doing that, if you ask them, they will tell you, I don't want people to look at me otherwise. So we need to stop looking at people otherwise, not just HIV, every other, you know, health-related issue that people are facing. If we don't stigmatize them, we give them that social support that they need.
And
in that
moral
particular
support and other stuff.
Exactly.
Thank you, Mr. Jallo. Then what do you think is going to be a general advice to the general public?
Thank you. Okay, just like my president mentioned here, the general advice is we have talked a lot here, talked about what HIV is, some of the ways you can acquire HIV. So I think we have also talked about the preventive measures. So I would advise the general public to adhere to these measures that we just talked about, and also you try and go to the hospital. From today on, like if you are watching us live here, go to the hospital and get tested. Know your HIV status. It's very important. Whether you are having the virus or not, just know your HIV status. In case you are having the virus, start the treatment as early as possible so that it will not advance to AIDS.
Yeah. How about you?
Yeah, so my final statement would be, let's break the barrier. If X can have it, then Y can also probably have it. So if X has it, Y has to support X and make sure that X still lives longer.
Okay, thank you so very much. The students from the public health, the University of the Gambia, we are so glad, the education Bantaba, to have you, and then I don't think this is going to be our final session having an interaction with you people. Our doors are open as far as education, sensitization, and sending awareness to the people in our own education on health, because we also believe that health is also important, and then health also should be prioritized. So education Bantaba will closely work with you to make sure that at least anything or any information you want to see, then we make sure we give you the platform for you to at least hear the information, both the radio and then online TV platforms. Anyway, still we'll send this acknowledgement to those at the receiving end, the audience, I mean, as I alluded earlier. Thank you internationally for always watching this program via the Education Bantaba platform. And then I also send my greetings to the director of Region 2 West, and then that of Region 2 East, and then all the schools within Region 2 West and Region 2 East, KM, and then you move into Region 3, Region 4, Region 5, and Region 6. All the Department of the Education within the Gambia College and then the University of the Gambia. Thank you so very much for always making this program a success. And then I'll keep on encouraging you people to follow the program, the Education Bantaba program, in all the social media on Atlantic TV, live at TikTok, Instagram, Twitter, Facebook, YouTube. You can have access to the education program at Atlantic TV. Thank you so very much. I am Mr. Masanya.